OneCare is an organisation that is owned by the practices within Bristol, North Somerset and South Gloucestershire. It is there to help practices survive and thrive to the future. We help practices by innovating and collaborating together to ensure that general practice can be sustainable.
General practice is coming in for stick at the moment because the workload has gone up, but within that there is still a great job to be done. There is continuity of care, you get to know people very well, and that deepens and improves over time.
I would recommend working in general practice for the huge variety of medical problems that you see, and also for the sustained relationships that you have with patients over many years, and also because of the huge joy you get from working in such a diverse team.
So we have a really good training and development package, an extra week's leave a year to be able to do your study. We do as much in-house study as we can because we've got a lot of GPs. We bring people into us due to our protection. We have regular clinical meetings where we have speakers come in as well. I've actually done a diploma in practice management, and we support all our nurses to do chronic disease management.
Training in North Somerset is brilliant. There are lots of courses on offer, both online and locally run in the various footprint areas, Bristol, North Somerset itself and South Gloucestershire. These courses are available to the nurse practitioners, GPs, healthcare assistants and nurses. It's a brilliant place for getting your knowledge up to date.
The team at the Charlotte Keel is a supportive team and has a similar goal. And I think if your goal is that you want to see what's best for the patients who are seeing you, you want to see good outcomes for them, then the team is going to go with you on that. If there are things that are beyond your competence level, then it's fine to go and ask other members of the team and get support with that.
In order to be successful with church and modern family practice, you have to be able to work as a team and communicate, be supportive of your peers and never be afraid to ask questions.
I work with a lovely team. They're very supportive, they're very helpful. They do a lot to support each other. They've made me into a leader, and I go forth and develop other people to be leaders as well.
As I work across 5 different practices, I work with a lot of different teams. They're all slightly different. I work closely with partner GPs at every practice. As well as that, I work with nurses, physiotherapists and the prescription clerks I work closely with. I've been involved in training them across all the practices.
Often people are quite stuck when you see them and you're talking about their long-term health condition. To be able to go with that person and be part of bringing them to a point where they feel able to take control of their own condition and manage it more effectively themselves, I find that a really rewarding and motivating part of my work.
The most rewarding thing about my role is having the opportunity to have follow-up with patients and see them on an ongoing basis and the difference that I get to make to their lives through the care that I provide.
My role varies in quite a few ways. I love looking after the patients that I have. I enjoy it when I'm able to help them through complicated hospital pathways and navigate them through care that sometimes feels really difficult. I really enjoy my training role within the practice to bring on a new generation of healthcare providers. I love being part of a team that just feels like we are doing the right job at the right time for our patients.